All right. Hello, everyone, and welcome. You know those health topics that always seem to pop up on the UPSC exams?
Yeah.
We're going to tackle a big one today. India's 2047 health vision. This Indian Express article we found, it basically lays out
Oh, cool.
India's roadmap to having a super healthy population. And it's not
Yeah.
just
By 2047.
by 2047, right? Not just about long lifespans, but making sure
Yeah.
people are productive too. I mean, think of this deep dive as like your cheat sheet for mains.
Yeah. Yeah.
Prelims. We'll hit all the important points.
Yeah.
But this isn't just like some boring policy stuff. We're talking about how this impacts
Right. Real world stuff.
real lives, yeah.
Yeah.
Millions of them. And of course, those exam questions too, right?
Absolutely. Can't forget those.
Exactly. So you guys ready? We'll unpack universal health care, the digital health mission, even some AI stuff. Let's dive in.
It's amazing how this vision really links health to economic growth. It's not just about building more hospitals, it's about human capital. The idea that a healthy workforce equals a productive workforce.
It's like investing in people so the entire economy does better.
Exactly.
And I bet this ties in directly with all those sustainable development goals and the whole socioeconomic development part of the UPSC syllabus.
You got it. It's like textbook mains question material.
Oh, for sure.
Imagine you get asked to analyze the role of healthcare in achieving India's vision 2047.
Oh, I can see it now.
Bam. You're
Yeah, there it is. Okay, so the article talks about this goal of having like really strong health systems
Yeah.
by 2025. That's like right around the corner.
Mhm.
And a huge part of that is universal health coverage, or UHC.
Mhm.
What does that actually mean for people?
Well, UHC is all about making sure everyone can access good quality healthcare without, going bankrupt.
Yeah.
It's got two main goals: financial protection, so people aren't wiped out by medical bills, and then service coverage,
Okay.
meaning everyone can get those essential healthcare services.
Got it. So it's not just being able to afford a doctor, but having like
The whole system.
a whole system.
Yeah, that supports you.
Right. But, India has a massive population. Isn't providing all that going to be super expensive?
That is the big question: resource allocation. UHC needs serious investment. Think better infrastructure, more public health spending. The article really highlights that both central and state governments need to up their game and allocate more funds.
And of course, we can't forget about the doctor shortage, especially in rural areas.
Huge problem.
It is. How does this roadmap even address that?
Well, the article talks about getting creative with technology. The idea is to train more frontline workers like nurses and paramedics and give them the tech tools they need to provide better care, especially in those underserved areas. Think mobile clinics, telemedicine, stuff that can actually reach those remote communities.
Okay, that's a good approach. It's like bringing healthcare to the people
Yeah.
instead of them traveling miles. But can tech really solve the problem of just not having enough doctors?
It's a valid point. Technology can certainly boost efficiency and reach, but it's not a magic solution. We still need more qualified doctors, especially specialists.
Yeah.
It means investing in medical education and training, which takes time, but it's crucial for India's future.
Long-term solution.
Yeah.
This makes me think about Ayushman Bharat. Isn't that supposed to be a big deal for healthcare?
It's definitely ambitious. Ayushman Bharat, the Pradhan Mantri Jan Arogya Yojana, it's the world's largest health insurance scheme.
It is. Wow.
It aims to provide financial protection to over 12 crore poor and vulnerable families. Think of it as a giant safety net
Oh, wow.
for people who can't afford expensive treatments.
So if someone needs surgery or specialized care, Ayushman Bharat helps with the costs.
Exactly. But it's more than just insurance. It also focuses on strengthening primary care facilities, building new health infrastructure, and integrating, digital technology into the system.
Wow. Sounds like it's tackling a lot of the big challenges all at once.
Yeah, it's multifaceted.
But is it actually working? I'm curious about the real-world results so far.
That is a fantastic question, and one you should definitely dig into for your mains prep. You see, Ayushman Bharat has made some progress in expanding access. Yeah. But there are challenges: implementation hiccups, ensuring quality of care, making sure the program's financially sustainable, all those things.
Yeah, it's like anything else. There are pros and cons, and the UPSC examiners will definitely want to see that we understand both sides.
Exactly. Critical analysis is key here.
Okay, let's switch gears a bit and talk about data. Can't ignore that if we want to ace the UPSC exams.
Absolutely not. Data is gold for anyone involved in healthcare, policymakers, researchers, doctors on the ground.
Everyone.
Everyone. And it's relevant for both prelims and mains. The UPSC loves to test your knowledge of current affairs and your ability to, like, interpret data.
So how is data being used to actually improve India's health?
Well, the article stresses the need for what's called disaggregated data. That's detailed info collected at the local level, like districts and blocks.
What's the advantage of having such granular data?
Because it allows for targeted solutions. Imagine knowing exactly which districts have the highest rates of, say, malaria
Yeah.
or malnutrition. Then you can focus resources and interventions where they're most needed. It's all about evidence-based decision-making.
So it's like having a microscope to zoom in on specific areas and really understand what's going on.
Precisely.
Makes sense. But data also tells us about those broader trends, right? Like the whole epidemiological transition thing.
Absolutely. Remember, India is dealing with a double burden of disease. Infectious diseases like TB and malaria are still a problem.
Right.
But we're also seeing a surge in non-communicable diseases, heart disease, diabetes, mental health issues, all that.
Yeah. And having solid data on these trends is crucial for developing good policies, right?
It is, absolutely. We need to understand the risk factors, the demographics most affected, how these trends are evolving.
Yeah.
It helps us stay ahead of the curve.
This whole epidemiological transition thing, it also reminds me of disease surveillance. What's the latest on that front?
Oh, disease surveillance is all about being vigilant. It's like a sophisticated early warning system for health threats. India's made good progress with the Integrated Disease Surveillance Program, or IDSP. It's like a network of watchtowers, healthcare facilities across the country reporting on specific diseases and outbreaks.
So it's about catching potential problems before they become huge.
Exactly. But the article argues we need to go further, embracing big data analytics to analyze massive amounts of health information. We're talking electronic health records,
Wow.
even social media.
Wait, social media, what does that have to do with disease surveillance?
Think about it. People often post about their health online. Researchers can analyze those posts and get real-time insights. They can spot potential outbreaks early on, track the spread of diseases,
That's wild.
even identify new health threats.
It's like a digital finger on the pulse of the nation's health.
You got it.
But I bet that raises privacy concerns too.
Definitely a valid point. It's a balancing act, leveraging data for public health while protecting privacy.
Makes sense. Speaking of cutting-edge tech, the article also mentions wastewater surveillance. What in the world is that?
You analyze sewage to predict outbreaks.
Seriously?
It's a real thing. You test sewage samples for pathogens like viruses and bacteria.
So you check the health of a community by looking at what goes down the drain.
Exactly. It's a powerful tool for early detection. By tracking those pathogen levels, scientists can spot outbreaks even before symptoms appear.
That's amazing.
Gives them time to prepare.
It's like an early warning system built into the plumbing.
You could say that.
This is mind-blowing. We've covered so much. UHC, workforce challenges, data, these incredible surveillance techniques.
And we're just getting started.
Oh, there's more.
In the next part, we'll explore even more. We're talking digital health, AI, community participation.
Oh, wow.
It's going to be good.
All right, everyone, stick around. We'll be right back to continue this exciting journey.
And don't forget to hit that subscribe button and share this with your fellow UPSC aspirants.
Knowledge is power, and we're here to help you ace those exams. And remember, all this info comes from a really insightful article in the Indian Express. Definitely recommend checking it out.
Yeah, it's a great read.
Stay tuned.
We'll be right back.
Welcome back, everyone. We've been talking about how India plans to, totally revamp its healthcare system by 2047.
It's been a wild ride so far. We've gone from making sure everyone has healthcare to using data to track diseases. It's incredible how much goes into it all.
Oh, and we're not done yet. Let's talk about something that's both a challenge and an opportunity: antimicrobial resistance.
Oh, yeah. AMR. I remember reading about those superbugs that are resistant to, like, a bunch of antibiotics. That's some scary stuff. What's India doing to fight back?
The article emphasizes monitoring AMR very closely. It's like tracking a moving target.
Yeah.
We need to know what strains are popping up, how they're spreading, and how we can develop new drugs to combat them.
Sounds like a constant race against these evolving microbes. It is. And it's not just India's problem. It's global, which is why international collaboration is so important. We need to share data research best practices to stay ahead of these superbugs.
This reminds me of something we mentioned earlier, the One Health approach. How does that fit in with AMR?
One Health recognizes that human, animal, and environmental health are all connected. So with AMR, we need to look at how antibiotic use in animals and agriculture can contribute to those resistant strains that end up affecting humans.
Well, it's not just about hospitals. It's about the bigger picture of antibiotic use across the board.
Exactly. We need a strategy that involves everyone. from doctors and vets to farmers and policymakers.
Okay, let's zoom back in on India's 2047 vision. The article dives into digital health. What does that actually look like on the ground?
Imagine a world where your medical records are online. You can video chat with doctors, and hospitals share information seamlessly. That's the potential of digital health.
Sounds super efficient.
Yeah.
What are some of the big things India is focusing on?
The National Digital Health Mission, or NDHM, is a huge deal. It wants to create a unified digital health system for India, connecting patients, doctors, and healthcare facilities through a secure online platform.
So it's like building a digital backbone for all of healthcare.
Precisely. The NDHM will allow for things like electronic health records accessible from anywhere, teleconsultations with specialists, online appointment booking. It's about making healthcare more accessible, efficient, and patient-centered.
This all sounds really promising, but I imagine there are challenges to implementing such a massive digital transformation.
Of course. One big hurdle is ensuring data privacy and security. When you're dealing with sensitive medical info, it's critical to have strong systems to protect that data from cyber threats.
Makes sense. What about access? India has a significant digital divide. How do we make sure that everyone benefits from these advancements, not just those with smartphones and internet?
That's a key question. Bridging that digital divide is essential. We need to invest in infrastructure, expand internet connectivity, particularly in rural areas, and design digital health tools that are user-friendly, even for people who aren't tech-savvy.
So it's not just about the technology itself. It's about making sure it's accessible to everyone and addressing those social and economic factors that contribute to the digital divide.
You got it. Digital health can be a powerful tool for inclusion, but we have to be mindful of these challenges and work towards solutions.
All of this sounds amazing, but it also makes me wonder about the human element of healthcare. With all this focus on technology, are we losing sight of the importance of human connection and compassion?
That's a great point. Technology is a tool. It doesn't replace human interaction. In fact, the article stresses the significance of community participation in healthcare.
Community participation. How does that work with digital health?
People are more likely to trust and use healthcare solutions when they've had a say in their development. Digital tools can empower communities to take charge of their health.
Can you give me some examples?
Sure. Think of mobile apps that educate people about health issues, connect them with local resources, and even help them track their health goals. There are also platforms where communities can share information, report outbreaks, and participate in health surveys.
So technology can help build bridges between healthcare providers and the communities they serve.
Exactly. It's about making people active participants in their own health and well-being.
This whole conversation about technology and healthcare makes me think about another buzzword, artificial intelligence, or AI. It's being used everywhere. But how is it impacting healthcare?
AI could completely change how we diagnose and treat diseases. Imagine algorithms that can analyze medical images to catch cancers, early predict patient outcomes based on their medical history, and even personalize treatment plans based on their genes.
That sounds like something out of a sci-fi movie.
It might. But it's becoming a reality. AI is already being used in things like drug discovery, robotic surgery, and personalized medicine.
But there must be some ethical concerns too, right?
Yeah.
Especially when we're talking about something as sensitive as healthcare.
Absolutely. Things like data privacy, algorithmic bias, and potential job displacement are valid concerns that we need to address carefully as AI becomes more integrated into healthcare.
So it's about finding the right balance, embracing the potential of AI while being aware of its limits and potential risks.
Exactly. We need to approach AI with cautious optimism, making sure it's used ethically and responsibly to benefit patients and society as a whole.
This has been an incredible overview of India's 2047 health vision. From fighting superbugs to digital health and the possibilities of AI, it's clear that India wants to transform its healthcare system, and it's exciting to see the progress.
And remember, this isn't just about policymakers and healthcare workers, it's about all of us. As future leaders, your understanding of these issues will shape a healthier future for India.
To our aspiring IAS officers out there, dive deep into these topics, understand the nuances, and think critically about the challenges and opportunities.
Don't forget to stay updated on health-related current affairs. It's a field that's always changing.
We want to thank the Indian Express for their insightful article that formed the basis of our deep dive. We highly recommend checking it out for a deeper understanding of India's 2047 health vision.
And as always, like, subscribe, and share this episode with your fellow UPSC aspirants. We're here to help you on your journey to becoming the leaders India needs.
Stay curious, stay informed, and keep striving for excellence. Until next time, best of luck with your UPSC preparation. We're back for the final part of our deep dive into India's 2047 health vision. Remember all that ground we covered? Universal health coverage, doctor shortages, the power of data, digital health, even AI.
Yeah, it's been quite a journey.
Now let's zero in on two big initiatives that are already changing healthcare in India.
Okay.
PMJAY, that's Pradhan Mantri Jan Arogya Yojana, and NDHM, the National Digital Health Mission.
All right.
Acronyms, gotta love them, especially for those UPSC exams. We've talked about them a bit, but let's really break them down. First up, PMJAY. What makes this program such a game changer?
Well, PMJAY, also called Ayushman Bharat, it's the world's biggest health insurance scheme. Really?
Yeah, aims to protect over 10 crore poor and vulnerable families financially.
Wow.
When it comes to hospitalization for secondary and tertiary care.
So, like, if someone needs surgery or specialized treatment, PMJAY helps cover the costs.
Exactly. It's about making sure people don't have to choose between their health and going broke.
That's huge. But it's not just about handing out insurance cards.
No. It's also about making the entire healthcare system stronger.
How so?
Well, PMJAY focuses on upgrading hospitals, setting up new health and wellness centers, promoting technology use in healthcare.
Oh.
It's a multi-pronged approach,
Yeah.
making good quality healthcare more accessible and less expensive.
Sounds ambitious. Is it actually working? What kind of impact has it had?
That's the question, isn't it? And a great one for your mains prep.
Definitely.
You see, PMJAY has definitely helped more people access healthcare, millions of Indians.
Yeah.
But there are still challenges. Making sure the quality of care is good, streamlining how it's implemented, keeping it financially sustainable, those are ongoing things. It's a work in progress then.
Yeah, but with huge potential.
Okay, let's move on to the NDHM, the National Digital Health Mission. This is all about using technology to change healthcare, right?
Absolutely. It's about creating a unified digital health ecosystem for India.
Okay.
Imagine all your medical records, safe and sound online,
Yeah.
accessible to any authorized healthcare provider in the country.
No more carrying those huge files around.
Exactly. No more trying to remember every detail of your medical history either.
That's so convenient.
And the NDHM also opens up teleconsultations. You can talk to specialists even if they're miles away.
That's really useful.
Breaking down those geographical barriers.
I like it.
Yeah.
But, India has a big digital divide.
True.
How do we make sure everyone can benefit from this, not just the folks with smartphones and internet?
That's a big concern, and one that policymakers are thinking about. Bridging that digital divide is key for the NDHM to work. Investing in internet infrastructure, especially in rural areas, making those digital tools user-friendly for everyone, regardless of tech skills.
So accessibility is a priority.
Definitely.
What about data privacy, though? All this medical info online, how do we keep it safe?
Data security is crucial. The NDHM has strong safeguards to protect patient information, encryption, authentication, other security measures to prevent unauthorized access, all that.
So patient confidentiality is protected.
Absolutely.
It seems like India is really taking a thorough approach to digital health, thinking about the technology, but also the ethical and social parts of it.
Exactly. It's not just about making things digital. It's about using tech to create a fairer, more efficient healthcare system, one that puts patients first for every Indian.
We've learned so much in this deep dive. UHC, the lack of enough doctors, the power of data, digital health, AI. It's clear India has a big vision for 2047, ambitious and multifaceted.
It is.
India's on a journey to change its healthcare, and it's exciting to see the progress. And remember, everyone, this isn't just for policymakers and healthcare professionals.
Nope.
This is for all of us. You as future leaders, your understanding of these issues, it'll be vital for shaping a healthier future for India.
Absolutely.
So to all our aspiring IAS officers, really dig into these topics, understand the details, and think critically about the challenges and opportunities.
Yeah, good advice.
And keep up with what's happening in health. It's always changing.
For sure.
Big thanks to the Indian Express for their article. It was the foundation of our deep dive today.
Yeah, great article.
Highly recommend checking it out for a deeper understanding of India's 2047 health vision.
It's a good one.
As always, like, subscribe, share this episode with your fellow UPSC aspirants. We're here to help you become the leaders India needs.
Right on.
Stay curious, stay informed, keep reaching for excellence. Until next time, best of luck with your UPSC preparation.